you see it all right?
Yes.
All right, we're ready to go.
Okay.
And we're going right into Trisha.
Hi, welcome to Choosing Recovery. My name is Trisha Gibson. I'm a licensed professional counselor, licensed independent chemical dependency counselor. We do this show here monthly just to discuss the multidimensional problem of addiction in our communities. Today we have a very special guest, and I'm very honored and very thankful that he took the time to speak with us today. We have Ohio Representative Jay Edwards. Mr. Edwards, thank you so much for being on.
Thank you very much for having me. I appreciate it.
Sure. So tell us briefly, what areas of Ohio do you represent?
Yeah, so it's called the 94th District, not that they can make that any more confusing because that means nothing to people. Represent most of all of Athens County except for Trimble Township, all of Meigs County, the eastern half of Vinton County, and the western half of Washington County over to the city of Marietta.
Okay. And I see that you do have a big social media presence. I see you're in all these communities on Facebook very regularly. What are you seeing in your jurisdictions as far as the issues of addiction?
You know, the one issue that I see, and it's great, it's such a talking point. Everyone is talking about this problem. It's something that, you know, the negativity around the topic of, you know, now it's hitting everyone. We've seen that it doesn't discriminate against race, religion, gender, wealth, how you were, what your upbringing was like, and that's not a good thing. But the positive side of that is now we're starting to pay attention. It's hitting everybody, and everybody knows somebody now that has been affected, whether it's within their own family, and it's really changing the stigma and the mindset. But there's so many people individually working on these problems in their own silos. And I guess one of the jobs that I've been trying to do is break down these silos and get people working together on a local level, so that because if we're going to fix this thing, it's got to happen on a local level.
Exactly. I've interviewed numerous guests on this show previous to this one. Guy County Sheriff Matt Champlin also agreed. And one of the questions I asked the sheriff was, what is the answer to this? And I think that we came to the consensus it's going to take a community. But in your mind, how can we all come together? What's your vision for that to happen?
You know, I think it's something to where, you know, unfortunately, there is a lot of treatment options. There tends to be more. There's not nearly enough. But again, I think everybody's fighting individually. So, you know, one treatment center on this street and another treatment center down the street are competing for the same pools of money from the state or from the federal government or from the local government, working with their drug courts. I think it's obviously a very uncomfortable topic still to just bring up in our communities. And, you know, it's really hard to make a change within our communities, especially in southeastern Ohio, where we just don't have a lot of our youth out in the public. A lot of them are at home on social media, you know, doing different things, playing video games. They're just not out. You don't see as many kids out in the community. So it's a tough issue to tackle. But again, I think it all starts on a local level, and I think we got to put these competition levels to the side. That really we're in this to fight for the issue at hand, and it's not about our treatment facility. It's not about our sheriff's office. It's about how can we help these individuals, get them recovery, while also doing the other thing, that the biggest thing that I think goes not mentioned is prevention. We're not going to need as much treatment. Hopefully we don't need as much. We're not going to need as many drug courts and as many funding options for different aspects of this epidemic. If we get in our schools and try to prevent more kids from going down this path, from saying no, from making the right decisions and not going down this path of it.
So one of the areas, I think, among treatment providers, I work for Woodland Centers. It's a mental health and addiction treatment provider. I know prevention isn't a Medicaid reimbursable service at this point. So a lot of it is grant funded. What's going on at the state level to help with prevention efforts so providers can get out and help with that?
Yes, there was over $100 million in this biennium budget, and a tight budget that we were able to take out and put into 4 different sectors. One of the sectors is prevention. There's been a lot of discussion and a lot of things, you know, number one, I think, going off topic here, I think our schools are overregulated with all the testing. So it's a good opportunity to maybe take some of that testing away, while implementing some of this prevention models for going about this thing to, the one commonality amongst most of our kids in our area, it's over 98% of the kids have in common. The one commonality is they attend public schools. So if we can get in there, it's going to be really hard to get them to join a club. It's going to be really hard to get them to the park to talk about this. It's going to be really hard to get them, again, a lot of kids in our youth stays inside. We can get them in this one commonality within their public schools, and I don't think we try to scare them, but we try to bring to light what the path that you're going down, and who knows, there might be a lot of kids, young kids out there that think the life that they're living is normal right now, and seeing what's happening within their own households, that we may be able to save some of these kids from what they're growing up in, thinking that it's normal. They might not even realize the situation that their parents or their family or friends are putting them in and what they're seeing every day.
I agree. I think that our youth face huge obstacles. I mean, it's in the home. They may see their parents or their grandparents or siblings using substances. So it's a huge issue, and I think I definitely agree with you that prevention is definitely needed in Southeast Ohio. I don't think we see enough of that, unfortunately.
Absolutely.
I know the Ohio Attorney General, Mike DeWine, has a huge opiate epidemic initiative going on. What's going on at the Ohio House to help with treatment, specifically with opiates?
Yes, so, we came out with a bill, House Bill 167, that we're calling Daniel's Law, named after a kid, Daniel Weidel, over in the Dayton area, trying to limit the amount of prescriptions, trying to change prescribing habits, each time you go in to get a prescription for acute pain, really trying to cut back on the number of pills that you were getting per prescription. In Ohio, one thing that you'll constantly hear about is the amount of opioids prescribed has gone down. But along those same lines, if you look at the numbers, the amount of people being prescribed opioids has gone down, probably because people are scared of this addiction. They're seeing it at home. Prescribing habits really haven't. They've gotten worse. Over the last 5 years, it's gone from about 65 pills per prescription to 67. We need prescribing habits to change. I don't think this is a fix. I think what the Attorney General's doing, you're seeing he has a lawsuit against the pharmaceutical companies. You're seeing trying to, and so within our bill that we've created, the governor came out right after we introduced our bill and we did this through a rule change. And trying to say that you can't prescribe for over a certain amount of time. I think 7 days for adults and 5 days for minors. So we're holding off on our legislation a little bit to see kind of if the numbers are showing that it doesn't need to be in a state code and that these doctors, these bad apples, it's not an attack on doctors. There's just as many doctors that are being responsible, but there are a few bad apples that are overprescribing. And we're holding off to see if this rule change by the governor's office holds true and changes some of these bad apples, and if it does, great. Another part of our bill was trying to increase access to the medication-assisted therapy, and not Suboxone, but Vivitrol.
Right.
The standalone Suboxone clinics are the modern-day pill mills. Suboxone serves a purpose in when you're getting mental health counseling and addiction therapy. When you're showing up and giving a vial of pills of Suboxone, number one, you can get or opioids, and number two, it has street value right away. So we're giving someone, an addict, the ability to do these things that I don't think is our main goal. So I think that you're seeing a lot of people attack this on a lot of different ways, and what I really like is through the legislative process, we have the ability to look at what the governor's rule change is, see what the changes that are being made, and manipulate our bill a little bit. Our bill may go a completely different direction by the time this thing's all said and done. Maybe it goes into the public education prevention program. Maybe it goes into trying to get Medicaid and other insurers to reimburse for things like massage therapy and acupuncture as a first line of defense for people within pain instead of opioids being a first line of defense. Opioids still serve a purpose, and we're not saying they don't. There's people that have been on them and using them responsibly that aren't addicts. But when it's a young 16-year-old kid that sprains his ankle, we don't think they should be getting 60 Percocets when they go to the doctor. And that's really what we're trying to do. We don't want to pull the rug out from individuals. I know the governor's rule change, that's not what they're trying to do either. But we really got a leaking faucet right now, and the first thing you do is shut off the water of the leaking faucet before you diagnose all these other problems. We got to stop the rate that we're getting people addicted, and the majority of these people are getting addicted from that their doctor prescribes them.
Yeah, and then we see it goes to heroin, IV drug use. One of the things, you brought up medication-assisted treatment and Vivitrol. One thing that we're seeing in Southeast Ohio, in Gaia, Jackson, Meigs, where I primarily work, we're seeing people that have opiate use disorders, they go on to a medication-assisted treatment program for Vivitrol, but then they start using other substances. Methamphetamine, we're seeing a huge rise in methamphetamine use in Southeast Ohio. Is that being addressed? Is that on your mind as you're making laws at the state level?
Absolutely. So again, along with Suboxone, Vivitrol, has a little bit less negative effects in the sense of you can't sell it, you can't get addicted to Vivitrol. But again, if you're not doing medication-assisted therapy with addiction treatment, it's not what it's all about. You can't show up and get a shot of Vivitrol and you're fixed. If you're still chasing a high, and we're seeing that in Athens County right now, where I'm from, and an area that I represent, the most populous area that I represent, Judge McCarthy up there in our drug courts, we're seeing a mad change from heroin and opioids to methamphetamines and cocaine, because they can still get high from that without the Vivitrol. So being on the Vivitrol. So I think it's something that, again, any of the medication-assisted therapy, that is therapy. It's not just show up, take a pill, and you're done. That's similar to what got us in the mess in the first place, is people felt pain, they took a pill to get rid of it, instead of really diagnosing what's bringing on that pain and how can we go about this a different way, rather than just taking the quick fix. We can't get out of this problem the same way that we got in, and we really need more therapy, counseling, addiction therapy. We also need to just have more conversations. It's an uncomfortable topic that, if we're going to fix, we got to get very uncomfortable about. And I think I stole that quote from a very good representative named Ryan Smith that represents your guys' area, and you guys have a very good one down there. And he's very passionate about this. He worked with me a lot on this legislation. It's something that we're seeing the stigma change. It used to be, especially amongst older generations, that we blame the addict. It was their fault. We're seeing that change, and that's a good thing that's coming from this. Why it's changing might not be a good thing, but it is changing.
Absolutely.
So we got to take advantage of it and pull our communities together, pull all the people fighting together, our drug courts, our sheriff's offices, our law enforcement, the laws itself, communities. I think churches play a big role in this. How do we get our organizations and groups together to get less people addicted, while also getting people that are in that process right now help? And then also not getting them back addicted. And the recidivism rate is ridiculous. And I think most of that is because of, they get done with addiction therapy, they get done with treatment, and we send them right back out into the environment that got them addicted in the first place. If we're not going to go about this thing on a full scale and address every issue from start to finish, I think we're kind of wasting our time at this point, because we've tried that. The state's thrown money at the problem. It hasn't gotten better. Money serves a purpose. But we got to spend the money smart and make sure we're doing things from start to finish and addressing this issue.
Absolutely. So far, we're having a great conversation. We're going to take a quick break, and we'll be right back with Representative Jay Edwards.
So is it an actual break, or are we just saying it's a break?
All right, I'm Trisha Gibson, licensed professional counselor, licensed independent chemical dependency counselor. We're here talking with Representative Jay Edwards. Really great conversation about all the work you're doing at the state level and how you're working with other agencies, and even in your own communities. We're seeing a lot coming out from your office, yourself included, out in the community. What's your Facebook address so people can connect with you?
Yeah, it's at J Edwards Ohio on Facebook, Instagram, and Twitter, so you can follow along. And one of the biggest things I try to do with my social media is just show that I'm open into the public. I think there's so many of these issues that, in the world that we're living in right now, everyone is polarizing on, what side of the aisle that they're on. And what I try to do with my social media is show people that I don't care about whether you're a Republican or a Democrat, a male or a female, I don't care about any of that. The drug problem we're seeing isn't Republican or Democrat. It's all of us, and we really got to sit down and have some real conversations. And I think I've done a lot of that within my district, but anywhere, if there's someone that can provide insight to me, that can help me know of an issue, that can help me fight on an issue and wants to come and work with me on it, I don't care what side of the aisle you're on. I don't care anything. All I care about is trying to help southeastern Ohio and Appalachia.
Absolutely. So in addition to Facebook, what's the easiest way people can get in touch with you, give you ideas or feedback?
Yeah, so my constituent email is rep94@ohiohouse.gov. And it's a very easy way to get a hold of me. And then I'm going to look up something here real quick. I have my office phone number I'll give out. It is 614-466-2158. My aide is Jacob, and we return every call and voicemail and email that we get. So anybody can feel free to contact us whenever, and it doesn't have to be on this topic, any topic. And one of the things that I'm trying to do as well is work on an Appalachian delegation. Representatives from around the Appalachian area, from all the way up in the northeastern corner to over around Cincinnati, if you touch it, both House and Senate, and Republican and Democrats coming together. The drug problem is bad everywhere across the whole country. It has a little bit different meaning to us in Appalachia. High Medicaid populations play a different role than we're seeing in other areas. So we got to make sure that we have a seat at the table and we're fighting together on issues, not just on this, but economic development across the board. It all helps. And it's a matter of us fighting together. And you see real quick in Columbus when you see the Franklin County delegation stand up, and there's 16 of them. And you see the Athens, Vinton, Meigs, and Washington delegation stand up, and there's one or two of us.
Right.
You see why we're left behind, and we're all fighting individually, similar to the drug problem. We're all fighting individually as opposed to coming together. Mm-hmm. And that's one of my big strides right now, is trying to get this Appalachian delegation together to fight for our area, to make sure that when we're addressing the drug issue, or we're addressing public education, we're addressing economic development, we're addressing it in a way that isn't just Columbus, Cleveland, Cincinnati helping them, but helping us in southeastern Ohio as well.
Exactly. As a treatment provider, we have a huge lack of resources in our area. You're very much aware of that. So I think that's a great idea to get more people to come together. Before the break, you mentioned working with criminal justice. So again, we've mentioned Medicaid. That's people that's incarcerated. It's not a Medicaid reimbursable service. So we're lucky enough in Gallia-Jackson Meigs to have jail services grants through the state to provide inmates with mental health and addiction treatment. Is there any focus at the House or at the state level on helping people that's already incarcerated? Because I think that's really the fundamental level where providers are seeing this occurrence and kind of the first entry point into treatment.
Yes, so there is some money in this biennium budget to address treatment within people that are incarcerated now. There's also something that we passed called TCAP, and I could tell you what that means. I'd have to look it up real quick. But it's an alternative route for inmates. We hear it every day of people get in trouble. They're a drug addict. They're not dealing. They haven't physically harmed anybody. They have no violent harm crimes, and they have gone to court. They get thrown in jail, and in 6 months they come out, and they're a full criminal at this point, because that's all they've been surrounded by while they've been in there. They haven't gotten any help. That month, that 3, 4, or 5 week period where they seen the light and they got free, and they were anxious about learning something new and going out, they were spent that time locked in a room, surrounded by people that were violent criminals. Mm-hmm. And I think that mindset is changing now too, to where we're seeing that prison or incarceration isn't the best route for some of these folks. We're seeing it get worse, and recidivism rates going up because of it. Mm-hmm. So we passed something in the budget to say a certain select few, if you didn't have a criminal history, first-time drug offender, you were an addict, no violent crimes, no violent past, we're going to put you on maybe a county-level jail or probationary system. I think that was a great step in the right direction. A lot of the counties were kind of upset more over the funding outside of the principal, and everything always comes down to funding. But I do think it's a step in the right direction that we're having these conversations. Director Gary Moore of our Department of Corrections in Columbus was a big player in that, and you know, it just shows that the Department of Corrections wants to get our prisons, less people in prisons, and get help for these people. We're all trying to work together, and again, you know, it shows a sign of doing things. I think we have a real opportunity as a state to do things in an area that we don't want to be leading, but we are. We're top in the country as far as overdose deaths, something not to be proud of. Right. But we are. It is bringing a lot of people together, and we're all fighting this. But as many people are working on this in Columbus and sitting around a table and dealing with legislation such as I'm doing and working on funding, that's all great, and it's a big part of this process, but it's not going to be fixed here. It's got to be fixed there. It's got to be fixed by the organizations, the local communities, the treatment facilities such as the one that you guys are running, the good work that's being done on the local drug courts, breaking down these silos and these barriers and getting community people together that want to fight this thing together is what this thing is all about. And I think in the long run, it's actually going to make our communities a lot more tight-knit.
Absolutely. And in our counties, in Gaia, Jackson, Meigs, we're seeing a great collaboration between mental health, addiction, and law enforcement and the core systems. I think that all of us coming together, we're seeing great results. We do outcome measures for our jail services grants, and we are seeing a reduction in recidivism. So that's just evidence to prove that these programs are working.
Yes.
And the prison system is very much overloaded with people with mental health and addiction issues.
Yes.
What's the answer? How can we slow that process down? So I think it's a great conversation to have. How can we change the model of how we're approaching this? And it sounds like you're trying to address that in Columbus.
Yes, absolutely. And it, you know, again, it all comes down to funding and finding money. And when we're spending money giving someone incarceration, or incarcerating them, that's services that we could be spending that money on getting them help so that they're never in prison again and they can go be an asset to society, work, raise their children. You know, that's and maybe I look at the glass half full too much, but I still think there's a lot of hope within this epidemic that it's going to bring us all together and it's going to make a stronger community, and it's really going to change the mindsets around addiction and other things going on, the next epidemic that is to come. And we'll have a better way of breaking down these barriers and a better route of really doing things in our communities.
What would you say to taxpayers about spending money for addiction treatment when there's the stigma attached to addiction? They're criminals, or they're bad people, or they choose to do this. What would you say to taxpayers when you're in Columbus allocating money to help these people?
You know, I think it's something that if you talk to conservatives, and I'm a Republican, if you talk to conservatives and look at the landscape of taxpayers, we're spending a lot of money incarcerating these people over and over and over again. And if you really look at the grand scheme of how much tax money is going to go into one individual that's an addict that goes to jail, that's not giving the proper treatment, we're going to spend a lot more money on that individual over the course of time unless we get this problem figured out right now, get this person the right help. And I think in the grand scheme of things, we're going to save taxpayers money by spending money right now on this epidemic and trying to get these people mental health counseling, addiction therapy, medication-assisted therapy, and other options that are out there, maybe some we don't even know yet. It's actually going to save us money in the long run compared to what we're doing right now, where we're getting them into the system and they're never fully really getting out. And we spend a lot of money incarcerating these folks, taking care of them, working with them, and they're never really a chance for them. We never give them a chance for them to be an asset in society. So I think if you look at the grand schemes, the big picture, it should be pretty easy to get taxpayers to realize that this is actually a very conservative model of maybe spending less money down the road.
Absolutely. I'm not sure off the top of my head how much it costs to incarcerate a person per year, but I'm pretty sure that it's not very cheap.
Yes, it's very expensive, and our prisons already are overcrowded, and you know, we don't have enough. We got way more people incarcerated right now than we have space for. So it's a real issue, and it's something that hopefully we can begin to address through this epidemic to try to help.
Absolutely. How can your constituents get behind your efforts when it comes to mental health and addiction and support you? What help do you need from us?
The help that I need from you is I want to see the problem helped, and it looks like you guys are already on that right path. But as far as in Columbus, you know, talking to people around the state, you know, if you hear, you know, ask people, even ask our office if there's somewhere you can connect with, or maybe somewhere in Northwest Ohio or Northeast Ohio that you've read about or you've read a story about, to study. And see, oh, they're doing this. Maybe this is something I can do. And that's the other really unique part about this, is there is no best practices right now. We don't have that. You know, we're kind of all spitballing, trying to figure out what works, and every individual's a little bit different. And there may be facilities around the state or around the country that are doing things that are really working, that may fit what your needs are. So, you know, we want to connect those bridges and connect dots and connect you with representatives in those areas and connect myself with those representatives. And if we can develop legislation or funding around that from a state level, we're all for it. So it's about open communication, keeping things in the community level fighting, but also looking around at what's possibly working. And, you know, I constantly say it, people look at legislators as, you know, we create legislation and we're a body of the government. 95% of what I do and what I want to do is bridging gap, connecting people to the right space, the right people they need to talk to get them help, and using the platform that I sit on to bring awareness to these types of issues, so that we can really try to help these problems.
Oh, wonderful. We're out of time. Representative Edwards, thank you so much for joining us and sharing what you're doing. Great work in Columbus. Appreciate it very much.
Well, thank you very much too, and you have a really good one down there in Ryan Smith, and thank you very much for what you're doing in your community and trying to fight with us on this level, and I can only hope that we'll talk again real soon.
Wonderful.
Thank you.
Thanks.
That was fantastic.
Great. Thank you so much.
Yep.